let's talk about a simple guide that could genuinely save a life, maybe even yours. We're going to break down how to spot melanoma, which is a serious type of skin cancer, by learning the visual clues that tell you, hey, it's time to see a doctor.
So, let me ask you this straight up. It's a really important question, because with melanoma, just knowing what to look for can make all the difference in the world. What you see can absolutely save you.
And that's really the main point here. Yeah, melanoma is serious, but it's also highly treatable if you catch it early. So we're going to walk through the exact same mental checklist that dermatologists actually teach people for doing just that.
So we're going to kick things off with the most well-known part of the guide, the ABCDE rule. Think of this as your foundation for spotting most common types of melanoma when you're doing a self-check.
First up, A stands for asymmetry. So picture this. You draw a line right down the middle of a mole. Now, if it's a harmless mole, the two halves are usually going to be mirror images of each other. A big warning sign is when one half looks totally different from the other.
And here you can see exactly what I mean. See the typical mole on the left? It's nice and symmetrical. But that spot on the right? It's all irregular and lopsided. That lack of a mirror image is your first red flag.
Okay, let's move on to the next letter, B, which is for border. You know, harmless moles usually have these smooth, really well-defined edges. But the border of a melanoma, well, that can be uneven, kind of scalloped, or even blurry. It almost looks like the color is sort of leaking into the skin around it.
And check out the visual difference here. Just look at the clean, sharp line of that typical mole. Now compare that to the jagged, fuzzy edge on the right. That blurry border is another key thing to watch out for.
C is for color. And you know what? This is a big one. A normal mole is usually just one uniform shade of brown or tan, but melanoma can show up with a whole bunch of different colors in one spot. We're talking blotches of brown, black, gray, red, sometimes even blue.
The comparison here is pretty much night and day. A typical mole has that consistent color. The suspicious spot, it's just a jumble of different shades. That inconsistency in the color is a major warning sign.
Next up is D. Now, D can stand for diameter, bigger than a pencil eraser, but a much more useful way to think about it is different. This is what we call the ugly duckling sign. It's super simple. It just means a mole that looks completely unlike any of the other ones on your body. If you've got a bunch of similar-looking moles and one just stands out from the crowd, well, that's the one to keep an eye on.
And finally, we have E for evolving. And honestly, this might be the most important sign of them all. See, harmless moles pretty much stay the same year after year. A melanoma, on the other hand, it changes. So if you notice a spot that's growing, or changing its shape, or its color, or even developing new symptoms like it starts itching or bleeding, that evolution is a critical warning sign.
Now, the ABCDEs are great, and they cover most melanomas, but not all of them. There's a more aggressive type that grows really fast and doesn't always play by those rules. So for that, we have a whole different mnemonic, EFG.
This is especially for a type called nodular melanoma. It tends to grow a lot faster, often growing down vertically into the skin, which can make it more dangerous. So naturally, it has its own distinct set of warning signs you need to look for.
And here they are, EFG. E is for elevated, meaning the spot is raised up off the skin. F is for firm. It feels solid if you touch it. And G is for growing. And we're talking fast growth, where you see changes over just a few weeks, not years. If you spot something with these three characteristics, that's a signal to act quickly.
Okay, so we've got these awesome rules, the ABCDEs and EFGs, but it is so important to understand that they are just a guide. They are not a diagnosis. There are always exceptions and other things that can look like melanoma, which is why a professional opinion is non-negotiable.
For instance, other types of skin lesions can totally mimic melanoma. Things like a pigmented basal cell carcinoma might look asymmetrical or have different colors, but they're treated differently. This is where a doctor with a trained eye and a special tool called a dermoscopy is absolutely essential. And, just to make things even trickier, some melanomas break all the rules. You can actually have melanomas with no color at all, or ones that are really tiny, or rare types that don't fit the ABCDE pattern whatsoever. This is exactly why these guides are for raising suspicion, never for ruling something out on your own.
So the bottom line is this. Use the ABCDE and EFG rules to get familiar with your skin, to become aware, and to know when something just isn't right. But please, never rely on them for a final answer.
A professional medical diagnosis is the only way to know for sure.
So, with all this new info, what's your practical take-home action plan? What do you do now? Well, let's just break it down into 3 really simple steps.
First, just get in the habit of checking your skin on a regular basis, say once a month. Second, if you find a spot you're a little unsure about, snap a clear photo of it. Maybe put a ruler next to it for scale. This is going to help you track that super important E for evolving. And third, and this is the most important, if you see any of the ABCDE or EFG signs, don't wait, don't put it off, make an appointment with your doctor right away.
At the end of the day, while all these letters are really helpful tools, the single most important sign is change. Your skin is always communicating with you. This guide just helps you learn its language. So, the question I want to leave you with is this: what is your skin telling you?